12th, 2024 meeting of Legislative Oversight and Investigations Committee. Members, if you could just silence your phones, and at this time I would ask the clerk to call the roll.
Senator Rocky Adams. Senator Carroll.
Here.
Senator Douglas.
Present.
Senator Neal. Senator Nemes.
Present.
Senator Thomas. Representative Blanton.
Here.
Representative Burke.
Here.
Representative Fleming.
Present.
Representative Lockett.
Here.
Representative Riley. Representative Sharp.
Present.
Representative Stevenson. Representative Petrie.
Here.
Vice Chair Howe. Co-Chair Storm.
Here.
And Co-Chair Bowling.
Here.
Thank you.
Thank you. At this time, I would like to entertain a motion to approve the minutes from August 15th, 24.
So moved.
Second.
All in favor, say aye.
Aye.
Any opposed? The minutes have been adopted. At this time, we'd also ask those individuals who are going to report on the child removal and reunification to go ahead and state your appearances, and you have the floor.
Thank you, Mr. Chairman. Good afternoon. I'm Chris Hall. To my right's Austin Sprinkles. We're analysts for this committee, and we're here today to present the findings of research you requested from us in July of 2022 regarding various aspects of how Kentucky handles child dependency, neglect, and abuse cases. We looked at several issues, but we concentrated on two key areas. First, we examined whether the Department for Community-Based Service is adhering to appropriate procedures when determining if it's in the best interest of a child to remove them from their home because of safety concerns. Second, we investigated whether family court judges are consistently reunifying families once the families have successfully completed all court-ordered steps in the permanency plan. In Kentucky, child dependency and abuse cases, known as DNA cases, follow a particular process. They begin when a report is made of an allegation of child dependency, neglect, or abuse is made to authorities. DCBS conducts an in-person investigation, and if necessary, the investigator may petition the court to remove the child and place them in temporary custody of the cabinet. If this occurs, a social service worker is assigned to the case and works collaboratively with the family to solve the underlying issues that had the child removed in the first place. The process concludes with the court ruling on the child's future, which may involve reunification with the family or placement in another permanent living situation. If we look at where the various actions the committee asked us to look at they occur throughout this process. In order to provide you context, what I'm going to do is walk you through the whole process. We'll pause periodically and drill down a little deeper into the areas that you had concerns about. So in Kentucky, everyone is legally required to report instances of suspected child DNA. Kentucky law allows callers to identify themselves or to remain anonymous. The staff were asked to look at the feasibility of doing away with anonymous reporting. DCBS indicated a strong resistance to ending this option, and a literature review showed that having the anonymous option is industry standard and that every state surrounding Kentucky has that option. If we chose to do away with that option, it would require a statutory change. When calls come in to authorities, DCBS handles most of them through their 24/7 hotline, which, as seen here, received about 100,000 calls each year over the period we studied between 2018 and 2023. But not all of these calls have to be investigated. Statute lays out criteria that cases must meet before DCBS can accept them. These include the victim being a child or 17 years or younger, the perpetrator being a caregiver, And the facts of the case must meet Kentucky's jurisdictional requirements, meaning Kentucky can't bring action against a family unless it's meeting the statutory requirements of Kentucky's jurisdiction. So given those criteria, if we look back at those number of calls that are coming in, we see that on average about 46% of the reports are further investigated. Any report that meets those acceptance criteria is forwarded on to a regional office where it is assigned to a DCBS investigator who conducts in-person interviews with the family. Clearly, one of the things the investigator is doing is collecting enough information to determine if the alleged incident occurred. This is where many of you probably have heard a substantiated, unsubstantiated claim. That's what's happening right there. But the investigator's doing other things, which is what we're focusing on, and that is they're required by federal and state law to do a safety and risk assessment of every household that they investigate. And it's these assessments that we focus on because it's here that DCBS is really collecting information and starting to make decisions about what is the best interest of this child. The safety assessment focuses on answering the question of, is this child safe now? The risk assessment asks, what's the potential that this child could be a victim of DNA in the near future? During the 6 years we looked at, between 2018 and 2023, DCBS used two different tools. Prior to October of 2012, they used what was known as the Assessment and Documentation tool, which collected a plethora of information about children, their families, the history. The investigator would then use this information, paired with their training and experience, to determine the best course of action. Beginning in October of 2022, the department adopted a new Structured Decision-Making Tool, or SDM, to use for their safety and risk assessments. This new tool prompts investigators to gather specific information that's known to be good indicators of a child's current safety and of the potential risk they may have for future dependency, neglect, or abuse. Both of these tools meet the federal and state requirement. If we take a closer look at what the tool's doing, we see that the safety assessment determines the child is either safe, unsafe, or safe with the plan. Now, safe with the plan varies a bit, but it basically means that the family has the capacity to take care of the child. They just need help, they need services, and in some instances, DCBS monitors that family until the concerns are alleviated. The risk assessment determines if the child is at low, medium, or high risk for future dependency, neglect, and abuse. When the SDM models pair these two assessments, it kicks out or generates a recommended action that DCBS is to take, and there are four of them. One is to close the case, which means DCBS ends the investigation and has no further involvement. Services means either services the family will refer to services, or DCBS offers those services to them and continues to monitor. Just offers the services. The in-home cases is where they offer services, but also continue to monitor that family until the safety concerns are alleviated. The out-of-home ongoing care cases is where the child is being removed until those problems are solved and placed in temporary custody of the cabinet. The SDM tool's recommendations are not written in stone. The investigator has the ability to override the recommendations in favor of what, in their professional opinion, is a more appropriate option given the facts of the case, and the supervisor must approve that form. This table shows the frequency of various decisions DCBS investigators made over the past 6 years regarding how best to protect a child. We can see that in most instances, cases were closed once the investigator had considered all the facts. The next most common action was to open an in-home ongoing care case. The decision to remove a child and to begin an out-of-home care case occurred in less than 5% of cases. DCBS was unable to provide satisfactory explanation for the rare occurrence of blank entries in the database where we would have expected to see some information entered. We'll talk about that in a bit. When staff attempted to delve a little deeper into how the STM tool was being used and how useful those recommendations were, we started to encounter problems. When we look at how often DCBS investigators follow the STM tool recommendations, we found that of the 35,000 plus cases the department investigated over the period the SDM's been used since October of 2022, they overrode the SDM's recommendation 73% of the time. It's important to note that eventually requires supervisor approval. So that's two professional social service workers agreeing that the SDM tool recommendation is not the best option in the case before them. DCBS was unable to provide data-driven explanations for the patterns we saw in the override data. For just a couple examples, there were 266 instances where the tool had said the child was unsafe, but DCBS closed the case. There was 158 instances where the tool said the child was safe, but DCBS removed the child. These are just a few examples of concerning patterns we found in the data in DCBS's case data for which the department could only provide anecdotal examples. I want to be very clear here. This is not to say that those decisions were inappropriate. DNA cases vary widely. What solves problems in one case may not solve that same problem in another case. So they need that flexibility. Our concern as analysts was that they were unable to provide data-driven explanations of some of those patterns we found. To be clear again, DCBS can pull an individual case file and tell you why they made that decision. What they can't do is when I say there are X number of cases, X percent of them we made that decision because of this, X percent we made because of this, X percent we made that decision because of this. That's where we have a problem. And to summarize this recommendation, before we provide recommendations, I want to summarize our concerns. The SDM tool is new. We've realized that. We acknowledge it. Hiccups are to be expected anytime you implement a program. But DCBS, at the time we asked, did not have an active, full-blown evaluation program in place, and their inability to explain decisions to date without having to pull individual case files is concerning. For example, it's unclear if those blank data cells, what I was talking about earlier, are just data entry errors, or is it investigators not completing the forms, or is it a safeguard failing? The high number of overrides could be a training problem. It could reflect a lack of buy-in. The point is we simply don't know what the answer is. So our first recommendation, recommendation 2.1, is that the department should implement a process and schedule for regularly evaluating all SDM tools. Each of these should assess the tool's accuracy, its ability to provide data-driven explanations for the agency's decisions, and its impact on agency's ability to protect children. Recommendation 2.2 draws particular focus to the high rate of SDM overrides by recommending that the department review all instances of supervisor overrides, writing the SDM tool recommendations, by identifying any changes that need to improve transparency in decision-making. This could include having to add additional fields or modifying TWIST, which is their data collection system. And our third recommendation, because staff feel that some of the patterns we saw were so concerning that it's appropriate that the department report back to the agency how the evaluation of those SDM tools are going by October of next year.
Coming back to our overview of the whole child DNA process, DCBS has decided that removing the child from the home is the best way to ensure their safety. However, DCBS cannot act alone in this situation. Only a court can order the child's removal. The investigator has two options. If the situation is severe, they may file an emergency custody order with the court. If concerns exist but aren't as urgent, they can file for a petition for a temporary removal hearing, where both parties can present their case to a judge. Committee members expressed concern about the legal process once a child has been removed, specifically whether guardians ad litem are prolonging cases and whether the decision to remove a child can be appealed. If the judge grants a removal, the court must appoint a guardian ad litem for the child and may provide counsel for other parties if necessary. A guardian ad litem is an attorney that's appointed to represent the best interests of the child. Other court-appointed attorneys act more at the direction of their client. Statute dictates that these court-appointed counsel are to receive no more than $500 per case. Given this maximum rate, counsel may have more of an incentive to conclude cases quickly rather than prolonging them. However, judicial oversight provides safeguards against potential abuses. One concern committee members raised was whether the decision to remove a child can be appealed. Appeals are available through both the judicial system and an internal process within DCBS. Since temporary removal orders are not final, they may not be appealed. However, parents or custodians may seek an appeal through the judicial process once the court has issued a final ruling. This is not a new trial, but rather a review of the original court's proceedings to ensure that no legal errors were made that materially impacted the outcome. Appellate courts should only overturn the trial court's findings if they are clearly erroneous, meaning the record lacks substantial evidence to support the factual determinations. Additionally, while temporary removal orders are not appealable, aggrieved parties can file a petition for immediate entitlement to custody. This is an original action, not an appeal, and therefore falls outside of the scope of the report. However, it's mentioned here due to its relevance to the broader child welfare issues. DCBS also has an internal appeals process for reviewing certain decisions distinct from judicial appeals. A parent may request an administrative hearing to review a change in services or benefits. Additionally, a person found by DCBS to have abused or neglected a child may appeal the finding through an administrative hearing. Some cabinet actions, particularly those that have already been through an administrative appeal or matters which courts have been involved, are not appealable through these administrative hearings. In these cases, individuals may submit a written complaint to the Service Region Administrator within 30 days or may contact the Office of the Ombudsman in administrative review. Additionally, a child who's in DCBS custody or who has recently aged out may file a complaint with the Ombudsman regarding issues related to service decisions, case management, or protection of rights. As of July 1st, 2024, the Office of the Ombudsman has been moved to the State Auditor's Office to provide independent oversight for the Cabinet. Coming back to our overview of the whole process, we're at a point where the child has been removed and DCBS and the family are now working to create a permanency plan. This plan must be approved by the judge and outlines the family responsibilities and permanency goals for the child. The purpose of these plans is to provide family guidance and keep the courts informed of progress. Key elements of permanency plans including identifying the child's specific needs, evaluating the family's ability to care for the child, and creating a timeline for a permanent living situation. The plan is reviewed at least every 6 months and is adjusted to fit the child's changing situation. Staff were asked to analyze whether children were reunited with their parents after the parents completed these permanency plans. Although DCBS can track individual cases, it cannot analyze data across the entire system to identify trends. Additionally, the Administrative Office of the Courts, or AOC, does not track aggregated data on permanency plan completion rates. For this reason, we were unable to audit whether children were being reunited with their parents after the family completed their permanency plans. Although we could not evaluate permanency plan completion and reunification on a systemic level, staff were able to interview 3 family court judges from a mix of urban and rural areas in Kentucky. All 3 judges were asked about cases where they ruled not to reunify a child even after the family completed the permanency plan tasks. All judges noted that such situations happen, however, they are rare and typically occur in extreme circumstances involving physical or sexual abuse. Additionally, the judges noted that sometimes parents agree to relinquish custody. This typically happens when the child is placed with a relative and the parents believe their child would be safer remaining permanently with that person. Given the legal mandate for DCBS to update courts on family progress towards completing permanency plans, it is clear that the agency already collects some data on plan completion. By examining permanency plan completion data in aggregate, DCBS could identify trends and areas for improvement. Without a clear understanding of permanency plan progress, it is difficult to evaluate the efficacy of reunification efforts and to identify potential systemic issues that may contribute to adverse outcomes for children. In the absence of additional data, it is unclear if this is simply a data collection issue or whether the agency's data system will need to be updated to accommodate aggregate analysis of permanency plan data. This leads us to recommendation 3.1, which says that DCBS should implement systemic tracking of the completion status of permanency plans throughout an out-of-home care case. These data should be collected and analyzed in aggregate and across years to inform policy, program development, and service delivery improvements aimed at achieving permanency for children. DCBS should work with the AOC to ensure that how it tracks such data is compatible with the CourtNet data system. And this concludes our presentation. We will now take any questions.
Senator Thomas has a question.
I do, and thank you, Chairman Storm. And I apologize for being late. If you don't mind, can you give me just a 2-minute review of why you are concerned with blank structured decision-making recommendations, the nature of the high override rate, and you're concerned about the inability to explain patterns in aggregate case data? Can you repeat that for me, just briefly 2 minutes?
Repeat again what you wanted, please.
I'm on what's slide 8.
Oh, okay. That's easy enough. Okay, so the blank SDM recommendations.
That's structured decision making.
Yes, sir. When the form is completed, it generates a recommendation. If there's a blank cell, and when we look at, so we have a database that has all the recommendations that tool is generating for each case. Some of them are blank. We don't know why. It's concerning because it may indicate the form isn't being filled out, which means if the form isn't filled out completely, it's not generating a response. That's why it's blank. It may have been a data entry error. We don't know. The whole point of to answer to all of these is we don't know. I can sit here and come up with questions. The high override rate, that tool, if the tools, the way it's set up is based on state standards, research-based, its decisions that it's spitting out should be the best recommendation. That's the argument that tool makes, and that it should comply with Kentucky standards. If that's the case, any tool, not just that tool, any tool, if that's your claim, should be providing good recommendations, should be followed more often than not. I don't know what that limit is or how to calculate X% is okay, but Y% is too much override. I don't know where that is, and the override is important to have because of the flexibility the agency and those investigators need. But we don't know why that override is so high. It may be something in the data set that needs to be tweaked. It may be something in the data collection system. Again, my answer to all of these are we don't know. I can sit here and come up with explanations that might explain them, but I can't tell you what % of the blank, and for instance, what % of the blank cells are because of this and what % are because of that. All I can tell you is X% of the data have blank cells, and that's all I can tell you. Did that answer your question?
Yes, thank you very much.
Certainly.
Representative Bowling has a question.
Thank you very much. Thank you all for the presentation. 2 quick questions, if you don't mind. The first is when a report comes in, when a complaint comes in, you talked about them interviewing, getting with the families, getting with the child, assessing their kind of where they are. But is there a requirement to go to the person that sent in the accusation? I mean, I know they can do it anonymously in some cases, but in cases that I've seen down where I live, it's been a school superintendent, a Frisky youth service center employee. It's been a school counselor. that have, sent these reports in, and nobody ever shows up to speak with them, to talk with them. Is that anything you all have any insight on?
Not in the data we have, no, sir.
Okay. And what about, there's specific timelines of when a report comes in, if it's accepted, if there's a high risk, near fatality, child fatality, it's within 4 hours, 24 hours for cases where safety risk and threats are present, but there is no report of fatality or near fatality, 48 hours where there are moderate levels of safety and risk, and 72 hours in cases with low risk of maltreatment. Do y'all have any data on, are those timelines filed? Or are those happening in a timely manner?
I know we did not look at that. Those, I'm not sure if we have that data. Those data should exist and should be able to be analyzed, I believe, but we did not.
Okay.
I will say that definitively. We did not look at that. And I can't recall if we have the data that would be necessary to do that, but I can certainly look at that for you.
Okay. That's good. Thank you very much.
Okay, thank you.
Representative Petrie.
Thank you, Chair. Thank you for the presentation. I just want to make sure that I've got phrasing and nomenclature accurate enough. Most everything, let's not talk about any cases other than a petition is taken for DNA. And let's talk about, subsequent to that, only those occasions for which those occasions in which a petition is taken for DNA and there is a removal from the parent or for the custodian. Okay, so that's the small segment I want to go to.
Okay.
In your presentation, you made there are several references to permanency plan. Okay, and I want to make sure that nomenclature we're on par. Permanency plan reviewed every 6 months or as close to it as you can is only after adjudication of that DNA case. So you've got petition, removal case works through adjudication. At adjudication, then there's a permanency plan that's reviewed every 6 months. Okay, yeah. How are you using the word permanency plan?
You can sometimes hear that referred to as case plan as well.
Okay, that's what I'm after,
yes.
Because I'm familiar with case plan during the case, and a permanency plan has statutory provisions about how often to be reviewed. That's the 6 months. Case plans have no such requirement of which I'm aware.
Right. It's the case plan, the permanency. If you look at the regulation, it speaks to that. They are referred to in regulation as permanency plans that we are talking about, but you will often hear about them referred to as case plans.
Yeah. So I'm going to go back into the court system, not from the social worker standpoint or DCBS standpoint.
Okay.
So when that petition's taken out for DNA, there is a removal. Was there any investigation or analysis over completion rates or timing of completions on working a case plan for reunification of a child with a parent or custodian prior to adjudication and a true permanency plan is instituted thereafter? Was there any look at just that segment while the case was pending before adjudication?
No, sir. That was far outside of the scope of what we were asked to look at.
And that's what I need to know. There's an issue about if the report is trying to investigate the efficacy with which this process is reunifying a child and adjudicating a case, then there is a component that we may be missing of while the juvenile case is pending in court system, when that case plan is being worked, guardian ad litems are actually applied to a child. Court-appointed counsel are applied to the other adults that are involved and have something at risk. That only extends to adjudication. After that, it's a different process altogether, and that's where some significant delays can take place with reunification or successful working a plan, even if that doesn't result in reunification, but working it as best those parents can. There's a lot of delay in that system that has nothing to do with the permanency plan and that part of it. But while the case is adjudicated, and that may be something that is fertile ground to explore either through this or through a corollary if it's amenable to the committee. Thank you for clarifying language.
My pleasure.
Seeing no further questions on this topic, we'd have the cabinets here today to offer a response. If you all want to come up to the table at this point and offer a response, then members, just so you'll know, after the cabinet offers their response, we'll take up a roll call vote. Thank you all for being here as well, and once you are situated, just please announce who's with you, and the floor is yours.
Thank you. Eric Friedlander, Secretary of the Kentucky Cabinet for Health and Family Services.
Yes, hi, good afternoon. My name is Wesley Duke. I'm the General Counsel at the Cabinet for Health and Family Services.
Good afternoon. I'm Lisa Dennis, the Commissioner with the Department for Community-Based Services.
Thank you. I don't know if you all hear this a lot when, you know, cabinets come up and the reports that are made, but I want to say thank you. Your staff was fantastic to work with. Chris and his whole team. The DCBS system is complex. The twist system, I-twist system, is complex. It was started in around 2000. So those of you who understand how technology may have advanced since 2000, you were in a computer lab. It is not the same system, but it is grown from that system. So the complexity of pulling information out, you heard it. We have concerns too. And some of the novel questions that your staff asked, we had to figure out, could we get them? How could we get them? It actually, again, in thanks to the staff, helped us think, how do we get that information, right? It's a system, and I think even when they came in, I said, this is a system that is primarily designed to be narrative support. Social worker notes, what the neighbor said, those kinds of things that are in there in narrative form. And so to pull data out of a narrative system beyond like the drop-down boxes that we have is limited and is a challenge. And so you saw the supported decision-making tool is relatively new. We are learning what is working and what is not, what are challenges and what are not. And for you all, those of you who've seen me present to families and children or the health services side have heard this before, but I want to say it for you all. It is not a perfect system, far from it. I say in all honesty, there are two mistakes that we make in this system. One is when we remove a child and recommend removal when we shouldn't, and then we expect that child to function with all the added trauma of being removed from their family, and we're saying we can do it better, and so often we do not. Or we don't remove a child who is in danger, and then we end up, I won't be specific, but you all know, those are the horrible tragedies around fatalities and near fatalities that we see, right? And those are, we make both of those mistakes. We do. And we work very hard not to. But I wish I could say we were perfect. I wish I could say we were perfect. This is why the SDM tool helps us. You saw the grid. Actually, in my estimation and from what I've seen in terms of presentations of what that process is, that was excellent. I might steal it. Because it lets you know where all those touch points are. With the most tragic outcomes, again, you all may know this, but I want you all to know there is a child fatality and near fatality review panel. Some folks sit on it from the General Assembly. They look at what are the most tragic cases that we see. Because oftentimes you can go through and look, we missed something here, right? Oftentimes, I think that's a fair thing to say. We look at oftentimes multiple touch points, right? So having you all come, look at our systems, make recommendations for how we can improve, and have what are difficult conversations. None of this was easy. Your staff did a great job digging down into this. I'm just saying that so they can hear it again. My staff had to figure out how to get the information that they were asking us for that perhaps we had never looked for in that way. We learned together through what was a challenging process, I will say to you, those of you that sit on any IT or budget committees. We likely, right? I told you how old that system is. We probably should look at new systems at some point, or look at new ways of getting information out of that system. I don't know if that ends up in future requests or not. This is not a very costly system. We think to run it is probably less than $1 million.
The structured decision making.
At the SDM tool, that's right. So it's not a gigantic cost for you all to know that. But we are learning, right? How you set up that structured decision making tool, right? What again, I'm downplaying this a little bit, but what sensitivity you set, safety, risk, services, right? Figuring out what that is something we're gonna learn. We will report back to you all what we learn. But I really wanted to come and say thanks. None of this was easy. Your staff did a great job, so hear that. And we are always open to looking at how we can improve.
We do have a few slides we will walk through, just talking about the recommendations and some clarifications. Here again are the objectives of the study, which you already heard from staff, what those were. The first recommendation 2.1, was around DCBS should implement a process and schedule for evaluating all structured decision-making tools. And DCBS is committed to doing that. We are working with Evident Change, who is the purveyor of those tools, of the structured decision-making model. And that model is a nationally recognized model. It's evidence-based. It's used by multiple states. And, Kentucky, as well as other states, is contributing data that is helping create that analysis and that evidence-based pieces. So we also, again, through Evident Change, we are working with them to do surveys of our staff around implementation and the fidelity monitoring of those tools. And we meet with Evident Change regularly to discuss implementation and to evaluate our progress. We're actually meeting with them next week. The second recommendation, the DCBS should review all instances where supervisors overrode structured decision-making tool recommendations. We just wanted to, just restate here that the social worker is completing a request for that override, and that is being reviewed by the supervisor and approved. So there is that level of review for every override, and the reason for the override is documented in the narrative. Now, it was helpful to hear from staff because we too, as we're looking at our data, we recognize that there is a need to build an automated selection for an override reason, so we can quickly pull that out of Twist and know why those overrides are being completed. But we also believe that we need to continue to provide that narrative because you can only get so much information from a data point. And the most common reasons we see for overrides is a child entering DCBS or relative effective kin care, or an existing companion case, which we'll discuss a little further in the presentation. And then the third recommendation was 2.3, was that DCBS should provide the Legislative Oversight and Investigative Committee a written update by 2025, and we again have no problem doing that and will.
Welcome it.
The next recommendation 3.1, was around the department should implement systemic tracking of the completion status of permanency plans throughout an out-of-home care case. DCBS will research that recommendation further and see what that feasibility of doing what that looks like. But we do anticipate that there would be significant and costly twist modifications to be able to implement. But again, we'll research and provide a response back.
And we do work with the court systems in AOC. We do, and we work with them well, and they've also been good partners. But this would likely require either some modification or some how the systems work together, what the interface would be. So, this is one of those things that you need both of us saying, yeah, we'll do this. I figure they will, but I wanted to make sure that it requires both of us, right, to make that work.
And so this slide, we begin talking about some clarifications. We heard from committee staff that the concern around the blank fields where within the SDM tool. So all investigations do not require an SDM risk and safety assessment, such as dependency cases, foster parent referrals, facility investigations, child care investigations. So those specialized types of investigations do not require those tools to be completed. And then remember, this tool was implemented in October of 2022. So any report that was received prior to October of 2022, but completed after October of 2022, those tools would not have been available for them to complete, but the field within the data system was created, but again, there is no tool that would populate those data fields. And then the next clarification, the department adopted the structured decision-making safety and risk as tools in October of 22, replacing the previous assessment and documentation tool. The ADT was not replaced, but it was revised to implement these tools. So the ADT that the workers used prior to implementation of the SDM model, they still utilize today. These tools were just added to, layered on. And then here, the SDM tool focuses on two questions. That we wanted to just clarify that these are two separate tools. There is a safety assessment. The safety assessment is completed early on in the case. Within the first 3 days, the worker completes that safety assessment. And it helps the worker to organize information, assessing for the immediate threats to the child's safety. And then the risk assessment looks at the likelihood that the child or family will be re-referred to the agency. It's not showing the risk of future maltreatment, but the likelihood that we may receive another report. And so it helps the worker to identify what those areas of need may be, and before they close the case, because the risk assessment is completed at the end, towards the end of the investigative process, it gives the worker the opportunity to say, okay, here are some areas of need for this family. Let's connect them to some services before we close this case so that we hopefully will not receive another referral to the child welfare agency.
I want to make one more point here. Where they had the grid, right, and the services piece. One is you saw the kind of services went up with a new tool, right, because we had a place to capture it, one. But two is so often a family would call us, right, didn't meet criteria for abuse or neglect, and there wasn't a lot we could do. And so we get the second call and the third call. Senator Carroll, I know you've heard that. Senator Douglas, I know, right? You get those calls, and we haven't been able to respond. We've started some pilot programs with family resource centers, with community action agencies, to ask them if we get a call from a family and we think they would benefit from services, we have a place to actually send that family to get some of those additional services. So some of that is because the tool has changed, but some of that is because we really have tried to think about prevention, getting upstream, so that when we get that first call, it doesn't turn into the third call or fourth call, that we're able to get some services for that family to mitigate what caused that call in the first place, or at least attempt to.
Correct. And on this slide, we are looking at how the SDM safety and assessment, safety and risk level assessments can guide investigators in making consistent and informed decisions. So this is the case action outcome from those tools. And just wanted to kind of step you through that. Again, the safety assessment identifies the immediate risk that is completed early on, up front, work with that family. And then the risk assessment is utilized to determine the likelihood that a family will be re-referred to the child welfare agency within 18 months. And then helps, again, the worker to connect the family to services. And then from those tools, a case action is recommended. So from the combination of results from the safety assessment and the risk assessment, the tool will make a recommendation of close, open, open in-home case or open out-of-home care case. So, and then the worker can override that recommendation for a variety of valid reasons. And we'll talk a little bit more about that here. Again, they are a number of reasons why a worker can override the SDM case action recommendation. Those include include relative and fictive kin placement, companion cases, judicial actions, static factors. So when committee staff began asking questions, and plus when we were working with evident change, we wanted to dig into this more. And we reviewed 956 cases that had an override decision. Because again, like has been shared, this is narrative. So each of those cases had to be reviewed manually to get this information. And we found that overwhelmingly those overrides were appropriate. So we reviewed cases where the tool said the child was unsafe, but we closed the case. We did not open an out-of-home care case. And what we found there, again, largely, was that there was a companion case that was already opened. So we received a new report or a new allegation involving a child where a case was already opened. So that referral was completed. It was transitioned over to the ongoing case, and it was and we closed out that particular referral. And just to clarify too, the case action of open, close, out-of-home care, that is not the finding. The finding is is separate. Those are separate individual areas. So we also looked at a number of cases where the tool identified the child was unsafe and the child remained in the home. Overwhelmingly, the reason for those overrides was because the child was placed in relative or fictive kin care. DCBS did not have custody, so therefore we opened an in-home case to work with the relative fictive kin caregiver and family. And then we also seen where a child was marked safe, but was in out-of-home care, and that largely was, again, when a child was already in DCBS custody, that was largely when, during the investigative phase, at one point in time, that the child entered out-of-home care. So anytime during that investigation, if that child entered out-of-home care, you would have seen that out-of-home care flag, but then the safety risk may have been mitigated, or the child may have been placed with relative fictive kin caregiver, or different things to where we mark them as safe, but again, you would still see the out-of-home care flag.
That last slide, again, is an example, I think I talked about it earlier, where the questions that got asked got us to ask questions. Right? And so we had to dive down into our data because, hey, what's going on with that? And then we have to, let's make sure what's going on with that. So again, I just want to, I know I'm doing this a lot, but right, that helped us, right? That helped us take a look at what the reasons are. So thanks.
And the last clarification was just around, again, the evaluation and implementation process. Again, we are working with Evident Change. We'll continue to do that. This is part of our continuous quality improvement process. We are developing data management tools now to help us evaluate and look at the effectiveness of these tools. And again, we're committed to maintaining fidelity to the model. And like I said, we are regularly meeting with and working with Evident Change to strengthen the use of these tools and improve their implementation.
Thank you all for your presentation and testimony here today. Members, I don't see any questions, correct? Oh, Representative Bowling has a question.
Thank you, Mr. Chairman. I'm going to ask you all the same question I'd asked earlier about interviewing the source. Is that required?
Here's my understanding, but I will defer to Commissioner Dennis. Not required is best practice.
And why is that the case?
It is best practice for workers if the reporting source is identified. That's a collateral contact. And sometimes that is relevant to the investigative process. And like I said, best practice would be yes. But the worker is determining what type of interviews are needed based upon the information they're collecting and gathering. They may have enough information already to substantiate, make a decision around safety, so that, again, that they feel like that was not needed. But again, best practice would be to.
So, follow-up question. So if a child reports to a school counselor that they're being abused at home, does it ever happen where that child is then, he's not interviewed on school grounds, the source isn't spoken to, the source of the report is not spoken to, then the child goes home in that environment where the abuse or the neglect is happening and they're being interviewed there? Does that happen?
We try to interview children at school or in a very neutral setting where, whenever possible. Sometimes that's not possible to do, and a child may be interviewed at the home. But if they are, we are interviewing them separately and privately from their caretakers.
Okay.
But about DCBS and about the complexities of the child welfare system, I would never say ever here. I'm sorry, but it's true.
And then as far as training for your caseworkers, I know that last I saw, our numbers of caseworkers had increased, and we were having a lot of turnover. However, the folks that you're bringing in, what kind of training is required for them? Is it training in Frankfurt, and then it's like, okay, you've completed your training, you're assigned to X county and good luck? Or is it, do they ride along with somebody that's had experience in this for years so they can learn the ins and the outs?
Yeah. So we partner with Eastern Kentucky University to offer a foundational training for all of our staff. So as new workers come on board, they are enrolled into those training curriculums, and then they also receive. So they'll spend a week in training, and then they'll spend a week back in the office with their team doing that ride-alongs, following, shadowing workers. And then we also have rolled out a field training specialist model where we are, again, assigning that worker to a more experienced worker. We have behavioral anchors to where that worker can provide, with the supervisor, can provide feedback to the progress the worker is making with training and how they are or what their needs may be for additional supports. So it's a combination of both.
And two things. One is we've worked a lot on the training because our workers were telling us for quite a while, and you can chime in, that the training felt academic, right, as opposed to how to do their job. So we've made some changes there. We'll continue to look at that. And you're right, we've had a lot of relatively new hires. Actually, our turnover rate's down from what it was, so we're excited about that. I think we still have 15.
What?
What's our turnover percentage?
Oh, it's low. It's
Low for us.
Yeah, it's 10 or under.
Yeah. So for us, right, we used to have a turnover rate of like 40. So it's significantly reduced, but that's still, we've got a lot of new workers out there. And I personally think these are probably the most difficult jobs. You're going into somebody's home, right? We've seen times when it's been dangerous, and you're asking folks to make some extremely difficult decisions. I refer to the social workers in our system as like everyday heroes. You know, you only hear about them in the paper when there's a problem, but what they do on a day-to-day basis, the trauma they encounter when they go out into the field, and what we've been seeing, and you know, our out-of-home care numbers are down a little bit, but what we're seeing, these kids, you've heard about it, their needs are so much more acute than what we have seen in the past. And again, you hear about these things. When a child like assaults staff members in a facility, we have trouble finding placement for them. These are the kids oftentimes that you hear about in our offices. These are those kids that no one in the state of Kentucky will take. And we work hard on that. Senator Carroll, thank you for working on the juvenile justice piece and that high acuity youth piece. Thank you. But we have kids that no one will take. We've got 48 kids somewhere in there, out of state, somewhere in that number. Do we have confidence in all those places? Do we have confidence? You know, no. But it is what we can do now to try to meet the best needs of the kids. But we've got a lot of work to do, right, to make sure that our kids are safe and being taken care of and getting their individual care needs met. We've got a lot of work to do there, and we will. And you all have been, the General Assembly has been great partners. You all have funded social workers, more social worker raises. That's why we've got more social workers, right? That's why our turnover rate's down, because our pay rate is up. These are things where, in partnership with you all, I believe we've made great progress, and we can continue to make great progress as we continue. Senator Douglas, you and I talk about this all the time. As we continue, we can disagree, but in the end, or we can agree, but in the end, we were working on the same problems together. And I have been very appreciative of the General Assembly and the willingness to do that.
We have several more people with questions, so Senator Douglas, go ahead.
Thank you, Mr. Chairman. Madam Commissioner, I want to direct this question to you, and I want to follow up on Representative Bowling's question, and that is, do you have any estimation of how often the interviews are able to be conducted at a neutral location in isolation, and could you also enlighten us on some of the barriers as to why that can't be done more often?
Answer to your first question, no. I cannot tell you how often that a child is interviewed, separate from the parents or not. Again, I can tell you if I read every case, it's in the narrative, but there's no data element that tells me that. And some of the barriers, some of it is timing of when the referral was received. So if it's received at 1 p.m. and we need to see that child that day, then we may not be able to get to school by 3 because our worker may be who's assigned that report may be already out on another case. And again, if it's high risk and we want to interview that child quickly, then we're going to go to the home to ensure that child is safe instead of waiting to the next day. And some of that is workload. Workload is, again, like I said, if you have a small county with limited number of staff, and workers are prioritizing the higher risk and time frames. So if they have multiple reports they're working on, those that have a higher risk or need are going to prioritize that to the front of their list, and then they're going to work based upon time frames. So if they have more time, and they have another higher risk case, again, that they're prioritizing every day on how to manage their workload and how to best serve families and keep children safe. It is our practice whenever possible to try to make sure we're interviewing children separately and privately from their parents in a neutral location.
Thank you, Madam Commissioner. Thank you, Mr. Chairman.
Thank you. Representative Blanton.
Mr. Chairman, Mr. Secretary, Commissioner, Mr. Duke, for your presentation. I'm going to go back on Representative Boland's question. I don't mean to sound ignorant. I want to learn here. But you talked about a week's training before they go out and they start working or somewhere thereabouts, right? Do social workers have any regular in-service training each year, continuing education, whatever that is required each year of each of our social workers? Is there something like that in place?
So let me clarify. I said the initial training that a worker receives is 4 to 6 months. So they will do a week in the class setting and then a week back in the office setting. And we do not currently have a requirement for ongoing education hours. I mean, to say specifically what that should look like, it is supported and encouraged. We are, like the Secretary said, doing a lot of work and evaluation of our current training system and implementing some changes in ongoing continuous quality training is part of what we're looking at and how we do that more consistently. But staff receive multiple hours of additional training every year. But to say that they're required to have 6 hours or 12 hours or 18 hours, again, we don't have that currently.
And one other point of clarification, social workers in DCBS are not licensed social workers like a lot of folks think about under the Board of Social Work. Now, the Board of Social Work has some of that, but the folks working for DCBS are not necessarily governed by that board. Is that helpful?
No, it is, and
Okay.
I wondered as we sit here and we talk. With my background in law enforcement, I know we had to every year, right? And not only does it help us learn in what we're doing, but it also gives us the opportunity to hear about trends and things going on in other areas of the state, and I could see it being beneficial to our social workers in DCBS as well if there was something like that. I know you all, that's an extra burden. I get that, but I'm just thinking, how do we turn out the best quality? Not that they're not the best. I'm not questioning that, but how do we make them even better, right, in doing their jobs? And that's just me thinking out loud. On the SDMs, I get that there's rejections. I get it's a form. I'm glad you all have the ability to reject it. I'm not a big fan of plugging in the boxes and here's what we do, because these folks, and again, I've worked with them a lot. I've been out on these referrals. I've even taken children out of homes before with them, and they're the boots on the ground. They're seeing what's going on. They get to personally view, and quite frankly, this is going to sound odd, but this is just personal experience. They get to smell the environment even, and they're there. So they need that ability. Checking these boxes may say you need to do this, but they're there, boots on the ground, saying, no, that's not what we need to do. Here's what's best for this child in this particular circumstance, because every situation is different, right? So I'm glad you all have that ability, and don't be afraid to use that when you need to. Thank you.
Senator Carroll with the last question on this topic.
Thank you, Mr. Chairman. And the first question follows along with what Representative Blanton said, and I don't disagree with him. But with that being said, to really understand the efficacy of the tool, there has to be data to be able to gauge those decisions, whether or not they're good decisions or bad decisions. And without that, the tool is really not a whole lot of help in predicting how effective the training is for social workers, the decisions they're making. So I think there has to be something built in to be able to learn from it and gain value from it. Just looking at it as 73% of the decisions being what the assessment tool shows being overridden, that doesn't look good at all. My first thought was, well, that tool's a waste, a complete waste. And I understand once you get into the reason, is it makes perfect sense. But I guess the question is of all that, and this is a national model and a tool that's used nationally. And I know with a lot of these types of systems, you have the ability to customize it, to build it, and how much flexibility is there to be able to build in some of these additional tools that are going to pull out data that will help to make it better in the future.
The tools are, again, because this model is an evidence-based model and it is it's nationally used, so there is certain fidelity measures and things that we have to adhere to. What we are currently working on, looking at, again, with our first round of data, really digging into that, is the data management tools that we need to develop, which we have some of those now, and then we're looking at others that we need to create. We agree there needs to be a drop-down box where it lists the override reasons so we can do quicker analysis. It took a long time to review 956 cases, just saying. Again, we too agree with that. We're building that in. And then we're meeting some of those reasons. We're on the risk assessment that you'll see a high risk. They're static factors. So you're looking at prior history. So once a caretaker, a parent has prior CPS history, that's always going to show up. Prior criminal background, criminal records, that's always going to be a risk. So some of those are never going to change. They're always going to be there. So how do we identify out of that risk tool which of those are static and which of those are not? So we're having those conversations with Evident Change as of next week, so we can really better understand what that risk looks like. You know, how long ago was that prior maltreatment? So if it was 6 months versus 5 years ago, then it may look differently. So we're continuing to look at that and look at ways to implement the tools where we have some flexibility and some customization, and data management tools too, so we can better gauge on progress.
One more, if I might, Mr. Chairman. In looking at, and I sit on the near fatality review panel, and it's, there are a lot of cases that we see what we classify as missed opportunities, and a lot of them are on the social work level, and as a process that we go through, and I saw this during law enforcement career also. Situations where it's repeat visits, repeat reports, not of the same incident, but of a long line. And sometimes I really question if we don't, whether or not we take the history seriously enough, and if we're just gauging that particular incident. And I think that's what gets us in trouble, because it normally escalates over a period of years. And what have we done in looking at situations with families when there is a long history, and where do we draw that line? And it always frustrates me a little bit when we look at reunification, and reunification is not always the best thing. And we've got it in our minds over recent times that's got to be the goal, that's got to happen. And, I see families that go through foster care that want to adopt kids. They've had the kid 3 or 4 or 5 years, and all of a sudden that kid is pulled up and sent back into an environment that may or may not be a good environment for that child. So I struggle with that, and it shouldn't always be family reunification. It should be what's best for that kid, period. And that kind of ties in with the question on when we do have repeat issues, what are we doing to escalate as far as our response?
Prior history is part of that assessment and evaluation, and it's part of this tool, right? When you're in part of what we are flagging for and this tool helps identify that there, again, prior history, and helps the worker to think about that in their decision making. So looking at prior history has always been part of our practice. It will continue to be. It is, looking holistically at the current allegations and the safety and risk concerns that are present within that family and how to best mitigate those. So we've recently done some retraining with staff around that was one of the pieces. It was, highlighting how we utilize prior history and in our decisions. So it is part of our practice, our policy.
So what about the thought of taking that out of the question in decision making where it's automatic? If this is the third time within a certain period of years and or months or whatever, and take the discretion out of it, so families know that the next time this is what's going to happen. Any value to that at all, in your opinion?
Well, not all reports are substantiated reports, and families and individuals are able to change and improve their situations and mitigate risk and concern. So making something automatic takes away that human element of the casework, and I think creates additional risk to families.
And I worry about automatics too. The other point that you were making, and it's well taken, is the reunification. That is a goal, kind of the federal funds that flow to Kentucky for all of that. Sorry to get too far down in the weeds, but it is the goal, right, that we get. I share some of your concerns. We see them. We see them. Yeah. It's not that we don't see it. We feel, I don't want to say bound, that might be too strong, but it might not be too strong, by what we're supposed to be doing relative to how we deal with those, with saying that we comply with all the requirements on that. But yeah, that's a very difficult, those are probably the most difficult. Those folks that have been with a family for 3 or 4 years, and then maybe the parents have gone through drug and alcohol counseling, behavioral health counseling, and feel like they're ready. And I'm not those are the cases that I'm not sure if there is a right decision, right? I don't even know if there is a right decision there.
Yeah, and I agree, and those are very difficult situations, but I've seen on the other side of that times when that wasn't the best decision for unification. And
I will tell you, our workers 100% agree with you.
Yeah.
They struggle.
And as far as the process, it's easy to Monday morning quarterback. And when you look at these cases that the child fatality and near fatality panel reviews, and many times it's like, how did they miss that? And again, it's Monday morning quarterbacking, and I get that. But my hope is that when those cases come back and there are missed opportunities, that and I know you all are reviewing those, but those really, from the expertise of the people on that panel, those recommendations need to be taken seriously, and I think there's training opportunities with that, and I learned something through every meeting, listening to some of the folks on the panel, but it's there has to be data to guide us down this road to make us better, to better protect our kids. Absolutely. And without that, we're probably just spinning our wheels to a large extent. So I'll stop there. Thank you, Mr. Chairman.
At this time, I'd ask the clerk to call the roll.
I'll make a motion that we adopt the child removal and reunification report.
We have a motion, a second. At this time, I'd ask the clerk to call the roll.
Senator Rocky Adams. Senator Carroll.
Aye.
Senator Douglas.
Aye.
Senator Neal. Senator Nemes.
Aye.
Senator Thomas.
Madam, Mr. Chair, I'd like to explain my aye vote, please.
Please proceed.
Yeah. I think we should accept the report. The report was done very thoroughly, and obviously a lot of detail was provided. But I would like to add that I really appreciate Secretary Freelander's comments, noting that these are not easy cases, that a lot of work was done to go in and look at 956 cases one at a time to determine what were some of the problems with them being overwritten. He acknowledged that there's much work to be done. So I was very impressed with the Secretary and the Cabinet's response to the report. But again, the report was well written. I see no reason why we should not accept it, and so I vote aye.
Representative Blanton. Aye. Representative Burke.
I'd like to explain my aye vote.
Please proceed.
I think the report is excellent, and I thank our analysts for putting together such a strong report. I hope that in the coming years, when we're looking at budgets again, that we'll proactively ensure that these recommendations can be afforded by DCBS, and even some of the recommendations that weren't included, like ongoing training, that costs money, and our children deserve it. The social service workers deserve it. I hope we'll prioritize it. Thank you.
Representative Fleming. Aye. Representative Lockett.
Aye.
Representative Riley. Representative Sharp.
Aye.
Representative Stevenson. Representative Petrie.
Yes.
Vice Chair Howell.
I'll explain my vote.
Please proceed.
I want to reiterate what people are saying about all the hard work that went into this. It is important. I want to appreciate all the work that Secretary Freelander and the members there have put into this too. I'm in these courtrooms multiple times a week, and it's definitely an issue that we've got to stay focused on. Some of these kids that are in these situations, it's not really something that we can comprehend. And the social workers that are there dealing with them day in and day out have an impossible task sometimes, and I appreciate the Secretary explaining some of the needs for some judgment calls and some gray area in there, because there's a whole lot of gray area in these kids' lives and the parents that are trying to work through these issues. Thank you.
Co-Chair Storm.
Aye.
And Co-Chair Bowling.
Yes.
Thank you.
So that report is adopted unanimously. I would ask that, speaking with Will, if you could follow up on Representative Petrie's question, please. Thank you all for that presentation. At this time, I would invite Ms. Markham to come up. And it is item number 5 on the agenda. Hello, have a seat, and make sure the green microphone is, or the green light's lit up on your microphone. And
it is.
Introduce yourself to the committee, and then you may proceed.
My name is Eva Markham, and I am the chairman, for the moment, of the Kentucky Board of Examiners of Psychology. And I'm sorry that I am a solo representative. I was hoping that one of my colleagues would be able to be with me, but most of them have to be at work. There was one who might have been able to run out in the hall and get on a phone from Paducah where she's on clinic, but that didn't work either, so here I am, and that's fine. I'm happy to talk to you about the Board of Psychology and answer any questions that you might want to ask me about the Board of Psychology. I put some papers together that I think may have been added to your packet that you were given as you came in, probably toward the end. I'm going to get my copy of those papers out in case you reference them, so that I know what I've given you. Just to give a brief history, the Kentucky Board of Examiners of Psychology has been in existence since 1948 in pretty much the same form as present. KRS 319 is the legislation that was passed in 1948. Establishing the board. Kentucky was the 3rd or 4th state in the U.S. to establish a state board of psychology, so we were among the leaders in the field at the time, and that was a good thing. Sometimes we stay ahead, sometimes we stay behind. I have always been proud that we've led the field in mental health innovation. At present, we have 1,600 licensed credential holders. We have 3 different licenses, which actually potentially are 5 different licenses because there are temporary licenses available for certain kinds of credentials. The board is composed of 9 individuals. 6 of us are psychologists who possess a doctoral degree. 2 are psychologists who are master's level practitioners, and 1 individual is a citizen at large, and our present citizen at large member is an attorney, and he has been invaluable. We have no employees. We are funded by licensure fees from psychologists. We do not receive any sort of state funding. We have no W-2 employees of the board, although we contract with Department for Public Licensing, professional licensing, for administrative services. In the past few years, we have gotten legal services through the Office for Legal Services, but they terminated their contract in June, and we are at the end of an RFP process to secure another attorney to work with the board. So that is the Board of Psychology. Since I first had interaction with the Board of Psychology, which would have been sometime around 1900 as an applicant for a credential, as long as there's been a board, there's been complaints. There have been complaints about how long it took, or sometimes it was too fast. You told me to come take my exam and I didn't have time to study. There have been complaints that it was unfair. There were complaints from consumers that it was too fair and people got licensed who shouldn't have been. Sometimes people are confused by the fact that there is a Kentucky Board of Examiners of Psychology and a Kentucky Psychological Association. People think we're the same thing. We are not. The Kentucky Psychological Association is the guild, and their goal is to make it better for psychologists in the state of Kentucky. The Board of Examiners is to protect the public. We do that 2 ways, by issuing licenses and monitoring those licenses, and then by accepting and investigating complaints from members of the public who feel they've been harmed by a psychologist. The licensing function is by far the most time-consuming. The 9 board members who provide services to our constituents are volunteers. They provide case reviews, credential reviews, services of whatever is in their job description as a board member on their own time and on their own dime. It is sometimes difficult, having been also a volunteer manager long ago with them when I worked for the American Red Cross. It is sometimes difficult to get volunteers to do what you want when you want them to do it. But I will say of the present board, the individuals who are doing credentials and supervision, which are 2 areas that month in and month out require a boatload of work. The individuals doing that work, by and large, each month complete all the work by the meeting date so that the board is able to take action on whatever credential or action is before us. We have had some difficulties over this past year. Calendar year 2025 started out with us having no staff. It's a little difficult to deal with a paper-heavy operation when you have no administrative support to copy your papers and scan your papers and disseminate these files to the proper people. I would say that Jamar Carter from DPL was exemplary in doing whatever his regular job is, plus being our board administrator. And I tried my very best to bribe him to just continue to be our board administrator, but he has done a wonderful job in recruiting 2 board specialists who have just come on board in the last 30 to 60 days, and it seemed to be equipping us to function really effectively. And I'm really thankful to Jamar for his persistence in looking for some good employees. If you look at the papers I gave you, there's our licensure status report. There's a little narrative from the Credentials Committee. There's a copy of the checklist that has to be reviewed on every single application. And it's kind of long and detailed, and it's why nobody wants to be on the Credentials Committee, quite frankly. And it's why, thank heaven, as chairman, I don't have to be on that committee because I can appoint someone else to be on it. Also included, I put our budget. We are, as I said, entirely supported by the revenues generated by our licensees and applying for licenses or renewing their licenses. You give us the authority to spend that much, some of our money. So I think this year, what did I say? We have the authority to spend $300 and something thousand. Right now, we have more than that at hand, or close to more than that at hand. So we're not in danger of going out of business. Our expenses are very predictable, except legal expenses. And if we have another First Amendment case, as we did when I was chairman of the board back in 2013, it could be a very expensive process. Normally, it's not. Legal expenses are not a huge item in the budget. Significant, but not huge. I could talk on and on. I've been on the board now. This is year 13, not of one continuous term. I was appointed in 2008 and went off in 2016. Came back on in 2020. I serve on the board because I feel like I've had a wonderful career as a psychologist, and I should give back and try to make it possible for the discipline to maintain a good reputation and provide decent service to constituents, being other psychologists, and Kentuckians.
I think Representative Fleming has a question.
All right.
Thank you. Thank you very much for coming in, and I want to express my appreciation for your service, your past service and your current service. I know it's not easy, particularly being a volunteer, because it's very time-consuming, and to go through the paperwork and making sure things are run efficiently and smoothly as much as possible. I have received about 3 calls over the past month and a half about delays, backlogs, individuals who were scheduled in April, then scheduled in June, and now scheduled sometime in the fall.
What were they scheduled for?
For exam.
For the oral exam?
They're scheduled for the exam. That's what they told me, the exam. I didn't ask if it's a written or oral.
Yeah, because we don't control the written.
Okay. So they're concerned about trying to get themselves through the pipeline in order for them to serve the purpose. And as you know, particularly when it comes to mental health, there is a dire need for workforce. And I run a mental health center for some time, and we struggle to find people.
Which CMHC do you run?
It's not. No, it's a private.
Okay.
Yep. Private nonprofit. So we struggle, and so having these type of delays and backlogs is really, it's not really serving the public in terms of getting those services out to those who are in need. So can you comment on what, if there is a backlog, and then what does that consist of, and then how you might be addressing that?
If you're speaking of specific complaints, particularly if they were scheduled and then they've been rescheduled, we generally don't cancel. Did they have to cancel? If you cancel, right now the practice is you go to the end of the row, so that
she didn't cancel.
Okay. Did we cancel her?
My understanding, yeah. I mean, that's
okay. I think specific complaints are best handled by contacting me.
Okay.
Because without knowing who the individual is and looking at the folder, I can't give you an honest answer.
Okay, and I understand that, and I appreciate and I'm not coming from your blind side or anything like
Right.
that. But I'm just trying. Like I said, I fell with three individuals and questions and so forth. You mentioned a second ago about an attorney is on the board. Is there?
He serves as the citizen representative on the board.
Okay, and then does he also act as an attorney for the board?
No.
No, do you have an attorney on? I mean,
We
is there?
are trying to hire one. We were blindsided by OLS, who terminated us in June.
Okay, and so, but you're actively trying to find somebody.
Yes,
to put that-
our RFP is ready to be scored and acted upon.
And do you think that will help the process out in terms of getting the applications through
No.
the pipeline?
No. That is more important for reviewing regulations and dealing with complaints.
Okay.
The complaints against the public or by the public against psychologists.
Okay, Mr. Chairman, I have one more question.
Sure.
One more question.
Thank you. What barriers do you see in the statutes? Because I think you go back to like 2001, maybe the last time it was updated in terms of.
319 has been
I'm
updated recently.
Yeah, I'm trying to go back and see. I thought I had it right in front of me, and it was actually, according to the documents that I have, it was obviously you stated y'all created in 1948, but the last updated to the statute was 2001.
To KRS 319 in general?
That's the information's in front of me. I have
Okay.
not had. I just had this.
The legislature amended or changed sections of 319 in the last session.
That might have been for the compact.
Not, you mean SIPAC?
Yeah.
No, not SIPAC. It was pertaining to the licensed psychological practitioner credential. There has been a change added about continuing education, and I think there's one more.
Okay.
There have been at least 3 over the last 3 years.
Okay. Madam Chair, I guess my question is, have y'all looked at the statutes to see how you can tell us in terms of changing the process in order to make your jobs as volunteers easier so we can get more people in through the pipeline and out in the market to provide service?
Well, I think we're working with KPA, the Guild, to help ingoing licensees, on aspiring licensees, read the instructions, sign the documents. People are often held up because they fail to sign the document. You cannot sign a contract when you didn't sign it. It seems nitpicky, but when did you last get a mortgage and didn't sign the document? You know, the reason I can't speak to your 3 people because I haven't looked at their files, but many complaints, because I invite people to call me or email me. My contact information is known. When I start going back through files, I find, last month you were deferred because you had not signed the page that asks the serious questions. Have you been arrested? Have you had substance abuse problems? Have you been in a mental hospital in the last 3 years? If you don't sign that, you can't have a license. We would love to be nice and give people licenses because we know they're all good people. But the law does not allow us to do that. KRS 319 and the regulations which implement KRS 319 say what you have to do. And if you don't do it, as much as I would like to give you a license, because I like to make people happy, that's why I'm a psychologist, I can't do it.
And I'm not suggesting you reduce your quality, because we need to have licensed
I know you're
quality.
not.
But I am trying to figure out what we can do to help you as well as these other boards that I'm looking at doing, because they have similar problems and similar issues, in order for you all to do the best job y'all can, so we don't have backup, so we can get people out through the pipeline.
And this is something you all can't really address, I don't think, but as long as we are part of state government, a frequent source of difficulty is the mail. Now, I could just say it's all the fault of the U.S. Postal Service, but I know that when the mail comes to Frankfurt, it goes somewhere, and I don't know where it is, but it does not come to the lap of the Kentucky Board of Examiners. It goes somewhere. And somebody somewhere signs that return receipt, which goes back to the licensee, and they say, oh, it got to Frankfurt yesterday. But it gets to our office 7 days after it got to Frankfurt, which was 10 days after it was mailed. The instructions say clearly, if you documents don't get to us 10 days before the meeting, you go and you're set down another month.
And we do have a play in this, because we as a body write the law.
Yeah, I know you do.
And we can, yeah, I know that. and we can modify the law, and we can change the laws. So if you're looking to have a snail process, then what's the alternative? Digitally, whatever it might be.
I would love to go digital.
Then that's the kind of suggestions we might need in order to help the pipeline, in order to get people on
We would
that.
love to go digital. However, we have not found the tech support available through Kentucky state government to be adequate.
Okay.
Senator Thomas.
Is it Miss Markham or Dr. Markham?
Dr. Markham.
Okay, I want to address you properly.
Thank you.
Dr. Markham, Representative Fleming is not alone in talking about the concerns he has heard.
Oh, I'm sure.
In my area, I know a lot of clinical psychologists, a lot who I have respect for them. After I sat here last month and saw the volume of complaints with the Board of Psychology, that just really surprised me, because I think of the Board of Psychology as being a very professional, being a very highly educated board, that you expect things would go smoothly. And when I saw that wasn't the case, I too talked to these licensed psychologists, several of whom I know have a lot of respect for. And the commentary that I heard is very similar to what Representative Fleming heard. Mm-hmm. That there are a lot of delays, there's non-responsiveness. They said, Reggie, you don't know the problems we encounter with the Board of Psychology. And I'm not going to name their names. Mm-hmm. But I got that kind of consistent response from them that Representative Fleming just reiterated. And so I say to you, as I listen to you, Dr. Markham, if the problem is you don't have enough staff, then maybe you should come and recommend that we provide you staff. If the problem is that you don't have a legal counsel, maybe we should come in and say we need to appropriate legal counsel. But whatever the problems are, there's something wrong there, because we don't see this in other similar type of agencies. And where we have in the past, and I'll share this with you, Dr. Markham, last year we noticed a number of problems with the Board of Cosmetology. Mm-hmm. Okay, very, very similar in terms of the volume of complaints. As a legislature, we addressed that. And I am pleased to say that today, those problems have eradicated. Okay, and so whatever the problems are, I will just repeat what Representative Fleming said. You need to come back to us with some things that you think will alleviate these problems, will correct the issues that your psychologists here in the state feel is going on now with a high complaint rate, and let's get this resolved. Because we need to have psychologists licensed, we need to get them examined, because we do have serious mental health issues here in Kentucky that we've got to address. And right now it seems to me that the Board of Examiners is a big blockage in terms of getting these people through the pipeline and getting them out there where they can serve Kentuckians who have mental health concerns.
Well, respectfully, I would say that most people come through the pipeline without difficulty. In the last month, out of 35 or 36 that were considered, 2 were deferred, both for non-substantial reasons that they can rectify probably by signing a form or sending their check or something like that. So most people go through. A few people have difficulty, again, without the ability to examine all the cases specifically. All I can say right now is I see every month credentials completes their work, and any deferrals that are there, we see what the reasons are. I'm not saying that people don't complain. We have complaints since time immemorial about the board because we don't always get things done when we want, the way we want. I want to get people licensed. You've done a good job in making changes to the law. We are trying to change some of the regulations to make certain processes work better. We've been working in a post-COVID nightmare land where COVID hit and all of a sudden we couldn't come to Frankfurt and have our nice little piles of paper any longer. We couldn't meet with you in the room and say, all right, Mr. Thomas, I'm going to give you a oral examination now. I had to do that on Zoom. You know, had its own problems. Some problems that have caused delays and have been technical problems post-COVID. Some problems that have caused delays have been personnel problems, and some problems that cause delays are when we psychologists don't read the regulations, don't follow the rules. When the state of emergency ended, we had a disaster.
Representative Petrie.
Thank you very much, Mr. Chair. You've done a good job presenting presenting your case, and I appreciate that. And I'm not going to talk about any specific cases. This is all at a conceptual policy level is what I want to talk about just very briefly, if I may, Mr. Chair. I think everyone here, and including yourself, wants to make sure that applications that come into your board are effectively and efficiently disposed of, whether by grant or denial or resubmission or whatever.
Right.
Fair enough? Mm-hmm. Okay. We have received, I think many of us have received multiple complaints, and it's not just on one particular piece, which raises concern because of the first stated point. Number 3, are there any problems in the application process right now that could be or should be corrected, made more efficient or effective?
Other than immediately making it all digital, no.
Okay. Well, then I'm going to go back to 2 prior comments. It would be well worth the effort of knocking heads in the board and going, you know, how could people help us out a little here, whether it be digital submission or whether it be if there's additional authorization for use of your restricted funds or whatever it may be, which is one of the things we did with the Board of Cosmetology so they could update their technology. Mm-hmm. I don't know that we're situated to go, this is what you need to do to alleviate the complaints we're getting. But I'm going to place the burden clearly on the board. Let us know statutorily, we can clear anything regulatory out. Statutorily, we can reset a system. Statutorily, there's a lot to be done, and there's a lot of collaborative, cooperative work that can happen to go back to point 1, effective, efficient disposition of applications. Now, on that, me not knowing, regular application, regular weather, regular mail. How long should it take to dispose of an application from date of receipt?
If it arrives...
Date of receipt.
Date of receipt to our board?
Yes.
If it arrives 10 days before the meeting, it will be dealt with at the following meeting.
Okay. And
So-
if not,
It will be dealt with at the next meeting,
which is a monthly schedule,
correct?
so at a maximum 45 days out.
Yeah, somewhere in that vicinity.
So if we have applications, if we culled back through data and we found applications that weren't being disposed of in 45 days, it should raise an eyebrow of, what's going on?
Well, yes, I would like to see that. That's what's so helpful to know where the problems occur so we can go back and look. Now, I can go back through some of the old ones and tell you real quick where problems have occurred. Currently, I would be hard-pressed to find one that's out of the window, out of that window.
Mr. Chair, if I may. There's something you said there, and I don't want to play gotcha. That's not the point. But there's something you said there that makes me go back. I would really ask, just asking, that the board members knock heads and try to identify in a good session or 2 what could help us do this more effectively and efficiently. Because at this point, we may not have identified what problems there are in order to smooth those out so that process can work better. So I'm just simply asking if y'all would do that, and Representative Fleming may be the best one to get back because he probably speaks your language better. But if somebody can get back to Representative Fleming or whomever else gets designated and go, these are things like in 30 days, 45 days, could you get back to Representative Fleming? I'm just going to use that as an example and go, we've identified these 6 things we think might help us. Is that possible?
Yes, it is. Or I can certainly put it to credentials and examinations, and I'd say, what do you think would help us?
Yeah.
I think everybody is going to say technology.
Yep. So if you would, I'm just asking, that's all I can do. I'll ask if you'll do that and try to get back to Representative Fleming unless the chair directs otherwise. It wants it to come in on a different channel, that's perfectly fine. If you could do that would be great, because otherwise we're going to hit session 25 and we're going to have pressure to do something, and I don't want to do anything that's not going to help. Thank you.
Thank you, Representative. And I would also point out, if you could copy the Will Spears here, he's committee staff on this committee. And thank you for your presentation and your time today.
Oh, happy to.
Thank you. We have another matter here in a few
All
moments. We would ask the committee staff to come up to address the member request from August 15th at 24 at this time. Oh, no presentation. Okay. So everything is in the folders already? Okay. Thank you for your time.
Certainly. And as, as I said, if you have a constituent with an issue, please tell them to get in touch with me, and I will do my best. And if I can't fix it, I'll tell them why.
Thank you.
Thank you.
Seeing nothing else on the agenda for today, I'd entertain a motion to adjourn.
Second.